Hi, Matt.
Hi, Dr. Ivy.
How are you?
I'm okay.
Can you go ahead and confirm your first name, last name, and date of birth before we get started?
Mad ASMR.
Okay.
Date of birth is June 2nd, 89.
Okay. So what brings you in today?
I've been having a little bit of cough.
Okay.
And it's been going on for the last 6 months.
6 months, okay.
Also, I think this month is my annual checkup, so I'm also due for an annual exam.
Okay. Okay. Have you tried anything for that cough? Did you ever go see any other doctor before?
No, I just thought it's maybe like a cold and it'll go away.
Okay. But it's been 6 months. Have you noticed it's getting better or worse?
It just stays the same.
Okay.
It's like a nagging cough.
Did you have any other flu-like symptoms when this cough started that maybe went away?
No.
Okay, so I'm going to ask you a few things about your medical history. Hopefully we'll find some more information that can help us figure out what's going on. Do you have any history of asthma?
No.
Do you smoke or have you ever smoked?
I've smoked before, kind of like in my 20s, but it's been 15 years since I stopped.
Okay. Any difficulty breathing or any other symptoms along with the cough?
No.
Is it a wet or a dry cough?
Dry.
Do you notice it comes and goes throughout the day? Is it worse during certain times of the day?
It's worse at night.
Worse at night. Okay. Do you exercise regularly?
I do.
How many times a week?
2 times.
And is it strength training, running? What's
A little bit of both. I do cardio and resistance training too.
okay? Have you ever felt like you have difficulty breathing, or maybe you're breathing and just feel like you cannot get enough oxygen?
No.
No. Okay. Any history of thyroid problems?
I was diagnosed about 6 or 7 years ago with hypothyroidism.
And has it been controlled?
I'm not on medication at the moment, so I'm not really sure.
When was you say you're due for an annual? Did they check your labs last time that you had an annual? Okay, I'll go and check those to see what your history is. But I'll be asking for new labs today. Okay. Do you hydrate during the day?
I do.
Okay. And are you taking any medication regularly?
No.
Multivitamins or anything like that?
No.
Okay. Okay, and just lastly, any allergies?
Penicillin.
No seasonal allergies that you've noticed?
No.
Okay. So we're going to be doing an assessment. Just going to do a couple of swabs today. Make sure that we test for any viruses that could be affecting you, but 6 months, even if there was a virus, it's possible it's not going to be present anymore. I'm going to take a couple of measurements. Okay. Okay, and place this right here. Okay, I'm gonna go ahead and rest it. Okay, so that's 93 heart rate, 90 oxygenation, which is actually really low. Go ahead and take the blood pressure. Okay. Thank you. Just rest there. Okay, just let me know if the pressure feels too much. Okay. Okay. Okay, so that's 100 over 60. It's a little bit on the lower end. At any point during the past 6 months, did you notice any fever at all?
No.
No. Okay, I'm going to be taking okay, just going to put that on your mouth. There you go. Thank you. Just going to be putting this away. Okay. Okay, it's almost done. I'll check your pulse right here while that finishes. Okay, I'll grab it for you. 98.8. Okay. sure that they're symmetrical. Okay, they feel very full, symmetrical. Okay, that's good. Just going to take a look at your hands. Okay. Notice a little bit of moisture on your hands. Is that normal for you? Okay. And go ahead and squeeze my hand. Okay. You're going to go ahead and place your hand right here. Try to push. Okay. I'm going to let go of your arm and just try to keep it there. Okay. Very good. Okay. So I cannot really see your nail beds entirely because you have gel. Just making sure there's no discoloration by the cuticles. Okay. Notice a little spot right here. How do you know what it is?
No, actually.
Okay, it looks like a bruise that's healing. Okay, there's no swelling on the palm or redness. Just again a little bit of moisture. Go ahead and squeeze my hand. Okay, now you're going to go ahead and place it like this. Try to push on my hand. Okay, now I'm going to let go and try to hold it. Okay, no tremors. That's great. Okay, I'm going to be taking a few swabs. Okay, I'm going to have you look up for me. Okay, I'm just checking the soft tissue around your eyes. Now go ahead and look down. Okay. Okay, so now I'm going to be taking a swab of your mouth. Just just want to rule out any viruses. Okay, so I'm going to have you open. Okay. I tickle a little bit. Now go ahead and lift your tongue. Okay. That's it. Okay, now go ahead and just verify your information. Okay. Okay, I'm going to do a few more tests. I'm going to have you look right at my fingers, and I'm going to be moving them. Try to keep your eyesight on them without moving your hand. Okay, so now I'm just gonna, you can go ahead and relax. Just gonna palpate a little bit around the face. Just looking for any swelling. And if there's any tenderness or pain, please let me know. Okay, I noticed some decreased tension in the jaw area since last time I saw you. I know you were struggling a little bit with TMJ.
Yeah, today it feels a lot better.
Okay.
A lot better.
Palpate the sinuses. I'm going to start right above your eyes. Okay, I don't notice any swelling or pain. Notice any deviation. Okay. Go ahead and relax your jaw for me. Okay. Go ahead and relax. Oh, there we go. Okay. Okay, I'm going to look at your throat. Just go ahead and open. Can you go ahead and say, Okay. There's no inflammation or redness, so whatever this cough, whatever it's coming from, it's not from your throat. So I think we're going to have to do an x-ray to have a complete picture of what's going on. Okay, I'm going to do a taste test, so just go ahead and try to taste it and let me know if you can detect anything.
It's sour.
Sour. let's try this.
Sweet.
Sweet. I'm gonna do a smell test. Have you noticed any maybe smells that you know they're not there, but you can smell them, like smelling smoke or something similar? No? And have you noticed that sometimes you cannot smell or a diminished sense of smell?
That I did.
You did, okay. Let's try and go ahead and close your eyes. Inhale, take a deep, deep inhale.
It smells like soap.
Okay. Now you're gonna go ahead and cover your right nostril for me. Okay, go ahead and take a deep inhale.
Minty.
We're gonna do one more. If you can cover your left nostril for me now.
It smells like garlic.
Garlic. Okay, so sense of smell seems to be fine. Maybe you have noticed it being diminished, but it's definitely present. Maybe checking your eye reflexes. So you're just gonna go ahead and look at my nose. Okay. Go ahead and look at my nose. Okay. So your left eye reflex is a little bit diminished. Okay. So now I'm going to have you change into a patient gown and I'm going to do a few more exams, okay? Okay, Matt. Just going to palpate your lymph nodes so you can just go ahead and relax. Making sure that they're not swollen or tender. Okay, so submental lymph nodes seem to be non-palpable. Submandibular. Yeah. Notice a little bit of swelling on the right side. Is there any pain as I press right here? Okay. Okay. Preauricular. Non-palpable. Okay. Post-auricular, non-palpable as well. Okay, I'm just gonna take a look right here at your clavicle. I'm gonna unbutton the first button right here at the gown. Okay. gonna have you swallow for me a couple of times. So go ahead and swallow. Okay. One more time. Okay, and one last time. Okay. There's normal movement on your trachea. And it seems to be midline. Okay. Okay, so I'm just going to examine your head. Make sure that we don't notice any irritation, lumps, masses, tender spots. I do notice a lot of new growth of hair, especially the front area. Have you noticed any increased hair loss in the past maybe 3 or 4 months? No. Okay. Okay, I'm just going to measure the hair growth is about 8 centimeters. Have you had a lot of hair treatment done recently?
No.
Okay. About 9 on this side. Okay. Do you have your toenails painted at the moment?
No.
Okay, so I'm going to be paying close attention to the nails, anything that could indicate any health issues about 2 or 3, maybe even 6 months ago, because it might be related. Okay. Okay, I'm going to be doing a hearing test. Have you noticed any strange noises, any high-pitched noises that you know are not present, but you can hear them, or diminished sense of hearing?
No.
Okay. Any pain on either of your ears?
No.
Okay. Just going to go ahead and verify that your ears are not swollen. Just going to introduce this right here. Okay. Okay. It seems to be unobstructed. Go ahead and turn to your right, to your left, I'm sorry. A little bit of irritation and redness. Yeah. Now if you can hear this. Can you hear this? Did the second one sound louder or quieter than the first?
Louder.
Louder, okay. And if you can hear this, let me know when it stops.
No.
Okay. Go ahead and you hear that. hear this? Which one sounds louder?
Second.
Can you hear this? Let me know when it stops.
Stop.
Okay. Now go ahead and just face up. Can you hear this? Does it sound equal on both ears?
Yes.
Okay. How about now?
Yes.
Okay. Okay. Could I be making a clicking sound like that? And just let me know if you hear on the right or the left. Can you hear this?
Yes.
Do you hear on the right or the left?
Right. Left. Right. 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 Left. 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 Both. Both. Left. Right.
Okay. Okay, I'm just going to change my glove. Okay. Okay, I'm just analyzing the symmetry on your face, making sure we don't have any muscle wasting on either side or any drooping. Okay. Okay, those are very slight asymmetry, but it's within normal parameters. Okay. Go ahead and try to push my hand down by opening your jaw. Okay. Now I'm going to open your jaw slightly and try to push. Very good. Try to push my hand towards the right. Okay. Try to push my hand towards the left. Okay, that's very good. So I'm going to be moving on to your abdomen, and we're checking your legs, feet, and your back as well, just to make sure that there's nothing there. That would just be related to your annual examination, not necessarily to the cough. Okay. Just first checking for any visible marks. I notice a scar right here. Looks to be a few years old. Does it hurt at all?
No.
Okay. Do you know what that scar's from?
I had a mole. It was removed at the dermatology.
How did the biopsy come back?
Good.
Okay. Okay. Seems to have healed really well, so not really concerned. I'm gonna go ahead and take a listen. normal bowel sounds. That's great. Okay. So I'm going to be percussing on your abdomen, which just means that I'm going to be tapping really gently. Just trying to listen to any abnormal changes on the density of your organs. Okay. And I'm going to be pressing a little bit harder on your abdomen. It shouldn't really hurt, so if anything hurts, please let me know. Any pain here? Okay. Okay, everything is normal there. And move on to your legs. Okay, Matt, so we're just gonna notice a little bit of irritation in between your toes. Just these last two. Okay. And I did notice some white, it's like trauma underneath your nail beds on the growth that would correspond to about 4 or 5 months ago, which might even be consistent with that cough and when it started. So what I'm thinking is at this point it might just be lingering from a virus that you had that did not present as symptomatic except for that cough. Okay. Okay. Very slight Babinski reflex. I'm just going to check the pedal pulses right here. Okay, they're very symmetrical. Okay, that's pretty normal. You can go ahead and turn on your belly. Okay, Matt, I'm going to be unbuttoning your gown. Is that okay? Okay, I noticed a few moles that I would want the dermatologist to take a look at. I'm going to write that on your history and I'll give you a referral just to make sure. They're very small. feel your spine just to look at the alignment of your spine. Do you suffer from any back problems? No. Okay. Okay. Go ahead and listen to your lungs. Can you go ahead and take a deep breath? Exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. One more time. Okay. I don't hear any wheezing or crackling on the lungs. So my guess is that cough is just lingering from a viral infection. There might be some leftover inflammation on your chest. So we're going to have to do an x-ray. Just going to be gently tapping on your back. Let me know if you feel any pain. Okay. Okay, I don't know if there's any inflammation in the thoracic area that could be indicator of any issues with your lungs. Okay, Matt, so I'm gonna go ahead and let you get dressed and then we can discuss the results, okay?